Hi everyone, you are watching the Chrissy B Show, and if you're a new viewer, we are the UK's only TV programme that's really dedicated to mental health and well-being topics. Today we'll be looking at the effects eating disorders have on a person's mental health. We'll be joined by our resident psychologist, Dr. Audrey Tang, as well as medical nutritionist Babi Chana. We also have nutritionist Hannah Richards making some healthy teas later on. So to give you some background, an eating disorder is a style or routine of eating often driven by an intense fear of becoming fat. The two most common types are anorexia and bulimia, which, despite being separate illnesses, can have very mixed symptoms. According to a recent report produced by PricewaterhouseCoopers, it is estimated that 725,000 people in the UK are affected by an eating disorder. That's around 1 in every 90 people. Although many eating disorders develop during adolescence, it's not unusual for people to develop eating disorders later in life. In fact, there have been cases of anorexia in children as young as 6 and in women in their 70s. Many of these people are unlikely to be diagnosed properly due to a lack of understanding. So eating disorders can be fatal and have been proven to significantly lower the victim's life expectancy, with research suggesting that 20% of anorexia sufferers will die prematurely. So it's really important that we recognise when someone has an eating disorder and seek the right help. We'll be hearing more about where we can find that help later on in the show. But first, let's get to the news with Helena. Welcome to the show, Helena.
Hello, Chrissy. So, we've been discussing World Mental Health Day recently.
Yes.
And a few weeks ago we heard that Time to Change initiative has been given £20 million in funding, which is great news. And we mustn't overlook eating disorders. And the reason I'm saying that, a lot of charities have been saying that they work constantly to combat widespread failure to understand that eating disorders are mental illnesses. And they're normally dismissed as vanity, attention seeking, lack of self-control, you know, treated as though it's a phase and, oh, you'll get over it. And that's obviously really quite dangerous.
It is.
So good to keep talking, as we know. Moving on to, so a celebrity supporter of Time to Change. We've spoken lots about people who support Time to Change, and one of them is Melanie Chisholm, who is Mel C, who's better known from the Spice Girls. Yeah. And she's talked about things gradually, but recently has been talking about her battle with depression and eating disorders. And it was basically when she was in the Spice Girls. And so she see, you know, people thought she was living the dream. In reality, she was completely struggling. She was depressed, eating disorders, obsessive, working out, so insecure, and she didn't admit it to herself as well.
See, it's funny that because when you used to see her on screen, she looked so confident about herself, didn't she? And didn't look like there was any issue there.
No, just
so
absolutely
hidden.
Living the dream. All these little young girls and boys, I guess, screaming, thinking they were great. She also felt like the plain one. So again, the physical aspect, and she was under constant scrutiny. And she said she didn't have any control, and it was almost like the best and the worst all at one time, and she ended up not actually knowing who she was. She was just completely lost. Anyway, so she had therapy for her depression, and she found exercise, time out, and even acupuncture. But one of her best things obviously was her young daughter Scarlett, which it changed her life. It gave her new beginnings. But it was a really lovely story, and she was talking about how she won't be taking part in the Spice Girls 20th anniversary reunion,
really?
Which in a way you can sort of understand. And good for her, she releases her new album, I think any day now, so in the next few days, Version of Me, and it's plastered with her own personal stamp.
Okay, that's good.
So which is great.
Yeah, I suppose she must have felt like she didn't really have an identity, even though they all kind of had their own little thing going.
But it was contrived, isn't it? They're made into the group. And she said she was made to be the sporty, quite hard, aggressive one, and it wasn't her. So for years she had to portray something she wasn't.
Because when I saw her a few years after, she actually looked really feminine, nothing like what she did when she was in the group. So you could see it wasn't really, like you're saying, it wasn't her. It was just all.
So it's great that she's talking about it, because obviously people can relate to that. Another interesting story, Nina Martinic, she's now 20, and she has an eating disorder from an early age and just felt like she was completely trapped in a box. She's recovering, which is really great news, but just reading how at 12 she thought she was fat. She was referred to a children's mental sort of health place for a year to get help. She had a difficult family life, her mother died, and she was really, really lost. But it was quite interesting that she was feeling quite suicidal, and it was part of the reason that she didn't eat. But depression led to her anorexia, which was never really about food. So it was quite an interesting thing. But she had a light bulb moment, and a new stepmom that really believed in her and helped her get through things. And it's quite interesting. She said, life has its ups and downs, but you must be brave enough to keep going. Real strength is admitting you are vulnerable. And obviously, if you need help, to go and get it. So, yeah, it's a good story. Good for her. Also, new thing, I think we discussed this previously, but mental health specialists saying following these ultra healthy diets could have a negative impact on people at risk of eating disorders. And there's a new thing, which is a fixation with righteous eating, and it's known as orthorexia. So people think they're okay, but actually it's another form of eating disorder. And lots of people have got that. I
saw a program about that recently, actually. It's quite worrying, because you do hear so many things about, eat this superfood or take this from your diet, and you end up being so scared, like, well, what can I eat, what's good for me, what's this doing to my body, and it's quite difficult.
People, you don't know if it's good bloggers or bad bloggers, they could be giving bad advice, but so a lot of younger people don't think they need therapy, and that the solution to bulimia and anorexia is to eat clean, but obviously that's another obsession. So that's an interesting story. So eating disorders at hospital admissions nearly double. So this is what the NHS says over the last 3 years. And vulnerable teenagers are putting themselves under pressure by looking at pictures of ideal bodies and repeatedly on social media. And they obviously get that, you can develop body dissatisfaction because they feel they're not perfect. And there's one young lady she's 16, Freya Chandler, and she began suffering with anorexia at 13, which is quite a common age. And she used social images on social media to guilt herself. In the end, she was absolutely terrified of eating, downloading apps to help her get fit, and she wouldn't even touch certain foods for fear of. So she spent years and years.
How sad for 13-year-old, isn't it?
It's quite a common thing. And at the lowest point, her organs were failing. She said that, and she said she was told she could die. And obviously, her father was incredibly supportive, but devastated that he couldn't do anything about it. And that's another thing to remember, the families and parents, which is really important, who also need support. Moving on, Demi Lovato, who's a singer, very well-known singer, 24. She's now the co-owner of the rehab clinic where she previously sought treatment. So good for her. Okay. So she bought into the CAST Centre in Los Angeles, who helped her for depression, bulimia, and substance abuse, and it feels great to help others in the position that she was. Oh wow! So isn't that lovely? That's really nice. Really nice story. Moving on to why it's so hard to talk about male anorexia, which is a very interesting subject. A young guy who only a couple of years ago, Hugh Oliver, was speaking about his experience, how he was in a complete black hole. He doesn't remember the whole time any of his interests, because he was just completely obsessed about food or not eating. And there's a good website, which is Men Get Eating Disorders Too, but he actually keyed into that, and that really helped him get well, which is great. And also there was a fantastic Beat the Silence campaign, which is all about talking about male people, male sufferers. And John Stapleton, do you remember him? Broadcaster. He suffered with it for 30 years. He starved himself, but then his wife helped him, which is quite an interesting.
How did he survive that?
I don't know. I suppose, I don't know. I mean, who has it? So, 30 years. Got so many different ones. There's quite an interesting one as well about a young. She was 12 at the time. Her name was Gaylard, and now she's 50. She developed anorexia at 12. And she mentioned that it was her best friend. She didn't have anyone to talk to, and
anorexia was her best friend.
Yeah, she didn't. She had really quite a terrible family life, death, people being killed. But it's quite interesting that I think it was to do with love starvation. That was the main reason why she said she developed it. But there's an interesting little bit where she talks about how she worked in a Chinese restaurant in Cork. And she said, people don't understand, the person in the family that has an eating disorder will be the one to cook for the whole family. They love doing it. What I used to do, and what a lot of people with eating disorders do, is to look at cookery books and watch TV, and that's how she used to feed herself. I mean, for me, if I look at a cookery show,
you want to eat the food. I know.
I do.
So I suppose cooking for the family was kind of maybe hide what you're going through in a sense, because you can just make excuses of I've eaten already, or I've been picking so I'm not hungry, and like it kind of masks the problem, doesn't it? Yeah,
it does. But I thought it was quite interesting, a different concept. One more, time for one more? Yes. Okay, so it's something that actually came out today, and it's about identical twins. So identical twins with identical eating disorders, which is another interesting flip. So twins Taylor and Trisha are sort of caught in this cycle of binging and purging, and their parents say that they've dropped so many pounds, but because they're best friends and they have been all of their life, they're in this competition.
Oh dear.
And
so destructive.
So destructive. And I feel so sorry for the mother, Patricia, who says, the mother Vicky, she's tried to stop them, she's tried to do absolutely everything, she's tried tough love, but she feels like a failure because she can't help her beautiful little girls, which is just so sad. So she tried to, but the flip side is hopefully things will work out well, because one of the girls, Trisha, people have been saying, look, stop this now, you're doing it for attention. And one of the daughters said that no, it's not, my mind's messed up. So she's admitting that she sort of needs help. Yeah. So I hope that's the beginning.
Hope so too.
Very new story.
And so just a point on that, Helen, as well, it's very, very important for parents to get support, because as you mentioned, the parents end up feeling so guilty, and they try everything with their normal parenting skills and everything, but sometimes those things don't work. The children do need specialist care, they need to be referred to someone. But also you parents, if you have children going through that, you need to get help and support too, because it's such a difficult time. And feeling guilty isn't going to help the situation. You need to know what you can do to help them, rather than sort of beating yourself up, because it's not your fault. So what can you do? Thank you so much, Helen, and we'll see you next time. All right, guys, so now let's watch this video courtesy of the Mental Health channel that shows how one young woman found the courage to overcome her bulimia.
The thoughts of I'm not good enough and I'm too fat started. The earliest I can remember is probably 11 years old. The main reason was because I had an emotionally abusive ballet teacher, and she came into class one day and she told me if I stood a certain way, it would make my legs look thinner, and I internalized that. When my eating disorder started, it was mostly just restricting, and then that was probably lasted from middle school all the way through high school. And then when I got to college, I gained weight because, there's that whole freshman 15. My senior year of college, I started binging and purging. You couldn't tell that I had an eating disorder just by looking at me. A lot of people, when they think about someone with an eating disorder, they think, oh, it has to be the emaciated girl. But most people, majority of the people who have eating disorders, you can't tell just by looking at them. I think the biggest things keeping me hopeful are obviously my spirituality, my belief in God, and my support system. My friends have been tremendous, as well as my family. And without them, I don't think I would have any hope. And I know people in recovery, and so I know it's possible. Like, I know that you can get to the other side. It's just a matter of working hard and getting the right treatment, the right medication, and reaching out for help when you need it.
thanks very much to the Mental Health channel for that video. And if you'd like to know more about them, you can head over to our website, chrissybshow.tv, and go to contributors, and you can find out more information about them there. So after the break, we have more for you, so stay tuned. Welcome back to today's program, which is all about eating disorders. Now, we are going to be hearing from our experts a bit later on, but first of all, I'd like to go through some tips, and these are from helpguide.org, which is a trusted guide to mental, emotional and social health. So the first thing that they are suggesting is, number one, is to admit you have a problem. So they're saying that the road to eating disorder recovery starts with admitting that you actually have an issue. So they're saying it actually can be a very difficult thing to admit to something like this, especially if maybe you're still clinging to the belief that, even if it's in the back of your mind, that weight loss will make you feel happy, it will make you feel confident, and it will make you successful. And trust me, this isn't the case. Although I never had an eating disorder, but I also believed that when, if I lost weight, I would be happier. So, you know, I was hitting the gym every day and I lost lots of weight and I got really toned and I got the body that I always wanted, but I was still miserable. So don't think that that is going to make you happy by losing weight. So, you know, the happiness comes in other forms. So when you understand this, it can maybe take quite a bit of effort to break the old and unhealthy habits, but it is definitely possible. The second thing they are suggesting, in which we always talk about on this show, is to ask for help. So I know it can be scary and it can be quite embarrassing to maybe ask for help for something like an eating disorder, but you do need someone's support, and that could be a friend, it could be a family member, maybe someone at your local church, maybe a counsellor at school, could even be a work colleague. So, but you know, it's very important that, as this step is very important because it can actually help you recover. And some people actually find it less threatening to confide in a treatment specialist, maybe like an eating disorder counsellor or a nutritionist, which, you know, we'll be talking to later on. So do make sure that you set aside enough time to discuss your situation, hopefully in a quiet place, a comfortable place where you do feel comfortable to open up. Okay, and let's now go to the third point that they are suggesting, which is to find a specialist, as we mentioned earlier. So they're saying that eating disorder recovery is much easier when you have an experienced, caring health professional. So it's important to find a professional counsellor or nutritionist that specialises in if you have anorexia or bulimia. So, and also I think it's very important that you find someone that you can feel comfortable with, someone that you relate to. Because, you know, if you're with someone that you don't really gel with and you don't really feel like you get along with them very well, it can kind of hinder you. So feel free, don't feel bad for maybe saying, you know, I don't really want to continue, and trying someone else. That's, you know, that's your right to do that. Okay, and the next point that they suggest is to address any health problems. So anorexia and bulimia, they, as we heard earlier, well, as we're going to actually, they can be very deadly, and not only if you're underweight. So your health even might be in danger if you only maybe binge or purge occasionally. So it's really important that you do get a medical evaluation, and to make sure that you're on top of everything that is suggested for you to do by your doctor or health professional. And finally, the next thing that they're saying is to make a long-term plan. So once your health problems are under control, maybe you and your doctor or therapist can work on a long-term recovery plan. So this does involve, obviously, a treatment plan is going to be put into place, but I believe it's also very important to get to the root of why you have or had the eating disorder in the first place. So what was it that was causing you, leading you to start eating in a way that wasn't healthy? So what was the root? Was it maybe something that happened to you in your past? Was it maybe peer pressure, the way you see yourself? It's really important to get to the root, because you can have all the treatment that you want. You can have professionals on your side. You can go to nutritionists. You can talk to your friends and family. But if you haven't actually addressed why you got to that stage in the first place, you may recover, but then you'll find that you'll be slipping back into old habits very quickly. So do make sure that you do take some time to think, to evaluate your life and see what went wrong, what is it that led you to start that unhealthy eating in the first place. And if you feel that you can't do that on your own, again, you could seek professional help and solve it that way. But it's very, very important that you do that. Okay, so now it's time to take a look at this real life story of someone who had an eating disorder.
I'm not going to lie, for me, and I can only talk as I find, there were good things to my anorexia. I can't talk for all eating disorders, I can't talk for everyone, but for me, I loved being anorexic. I adored being anorexic. And it's that feeling of you taking control of yourself. It's that feeling, food is such an important part of your life, and to deny yourself that swooping, soaring feeling of like, yes, I'm on top of this. When you felt waif in your body, when you felt lithe and thin, you felt childish again. A lot of anorexics use it, apparently, or any eating disorders for that matter, use it to cling on to their childhood. I went silly, I went ridiculous. Your endorphins are firing, your brain is fired, everything's going over the place, and it's absolutely beautiful. And I think we need to talk about this because it's the problem that we have with drugs education as well. It's the exact same thing. People just go like, you know, don't take heroin, kids, it's properly bad for you, isn't it? And they say like, oh, don't take cocaine. And I'm not saying kids should take heroin or cocaine, but, you know, that would be awful. What I am saying is, people that take heroin and cocaine, at the time, at the moment, blooming love it. But I'm going to go out on a limb here, that apparently there are certain health defects to taking heroin. I know it's an uncommon thing to say, it's not ideal to take heroin, but anorexia is the same thing. In the moment, controlling myself, enjoying it, the brain firing, the body feeling beautiful. It felt like the world was on drugs, and that was incredible. But the problem is, there is a payoff. Everything is in balance, and for those, every one time you might feel on top of it, I used to say I would be winning at it. And that's how I felt. It was a game I played with my soul. And for every one time that I was winning at it, there would be 10 times that I would feel awful, that I would be pinching my stomach, that I would be lifting my clothes up just to look at my stomach in a bathroom, that I would punch myself in the stomach, that I would try and make myself sick, that I would walk far too far. All of these diseased, abnormal traits that I did. And then the skew shifted. It wasn't every one time I felt great, every 10 times I felt rubbish. It became every one time I felt good, there'd be 100 bad times.
So it began really when I was at university. So I was living sort of in a house with some friends, and I sort of got more and more interested in kind of like healthy eating and exercising and sort of healthy living. That kind of took off, and for a while it was kind of a normal level, sort of on an even keel. But it got to the point where it became a bit of an obsession, and so it got to the point where it was kind of taking over my life a bit.
My son had anorexia when he was 12. So basically when he was 11 3/4, he had a growth spurt. And so he wasn't at all fat, but he was quite stocky, and he was really mad about football and loved running and all that sort of thing. Just a really happy, sporty boy. Then he was 12, he went off to see his father in New Zealand for a few weeks, and his dad rang me and said, oh, we're a bit worried because he's doing loads of exercise and not really eating very much.
For me, there was never a set date, a set time, a set period of this is when your disorder developed. It's been an ongoing issue through, when you look back at it, I suppose, throughout childhood, my young teenage years. I had the perfectionistic personality traits and OCD tendencies, which were all underlying in me anyway from the offset. So when I was a teenager, I put on a lot of weight, and everywhere around me the signs were that to be respected and you know, for anybody to want to be a friend, or you had to look a certain way as a guy. You had to be this thin, muscular guy.
I was born premature, 3 months premature. Was in the hospital for a long time when I was born. because my lungs weren't developed yet and everything. I've had cerebral palsy all my life, and I use a walker. You know, growing up, going through the bullying and everything, it just really took a toll on how I thought about myself.
After the break, we'll be speaking to medical nutritionist Babi Chana, so don't go away. Hi, I'm Chrissy B, and my show is all about improving your mental health and being happy. Join me every Monday, Wednesday and Friday at 10 p.m. on my channel Sky 203. Visit chrissybshow.tv for more information and subscribe to our YouTube channel, Chrissy B Show. You can also follow us on Twitter and Instagram at Chrissy B Show and on our Facebook page, The Chrissy B Show. Welcome back to our show all about eating disorders. Now, before I meet my next guest, let's take a look at this video with psychologist Dr. Audrey Tang talking about the effects eating disorders can have on a person's mental health.
Hi Chrissy, thank you very much for having me. Eating disorders is a very important topic. So many people do suffer or have suffered from them at one point in time, and it's important to note that it doesn't just affect women. It is commonly associated with women, but many men can go through eating disorders as well. The four main eating disorders that we talk about are anorexia nervosa, which is the maintenance of weight at a very low, unhealthy level. There's bulimia, which in contrast to anorexia, people report a sense of feeling out of control when it comes to food. With anorexia, there's often a feeling of control when you suppress your eating or you're able to exercise to excess. The other two are the eating disorder non-specified, and this eating disorder not otherwise specified is one where you don't quite meet the criteria for anorexia, you don't quite meet the criteria for bulimia either, but it's still an unhealthy relationship with food. And the fourth one is binge eating, and this is just that feeling of out of control eating, just eating to feeling more than full, just feeling absolutely stuffed, and somehow just again not being able to control it. The whole thing about eating disorders really is that they are a very unhealthy relationship with food. Eating disorders can have a very profound effect on our mental health because we become obsessed with what goes into our body and what comes out of it. It's not unheard of people to count every single calorie, and that includes the equivalent weight that comes out of the body as well. You may become very obsessed with exercising and tabulating every single thing so you can make sure that there's a system of checks and balances, and that in itself can become very time consuming. The obsessive behaviors can also be related to exercise. You can start developing a fear of eating in front of others, and slowly that may result in us withdrawing from society as well. The other thing about eating disorders, and this, whilst they can affect men and women, this one relates more to women. Sometimes they are because the woman is trying to repress her womanhood, trying to repress her sexuality. When you have an eating disorder, if your weight plummets, such as with anorexia, your breasts will reduce, your periods will stop, and this keeps the body in a very asexual state. And so if the eating disorder has been developed as a result of trauma, this can be something that the person with the eating disorder is actually looking to do. Similarly, eating disorders can be because it's the only form of control that one has. In a very controlling family where you have to eat every single thing on your plate, what goes into your body, or at least what comes out of your body when no one else is looking, is a way of almost rebellion, a way of being able to control some small element of your life. The other thing you may start obsessively doing as well is looking at ways to lose weight. You may be constantly checking your appearance, constantly stepping on the scales. The whole problem with eating disorders as affecting mental health is that it starts consuming our lives, and that makes it very debilitating. The question of how you know if you have an eating disorder is a slightly loaded one, because sometimes you absolutely may not realise that you have an eating disorder. It may be to you perfectly normal to not feel hungry, to not want to have anything to eat, to drink just a few sips of water a day. But to other people, that's where we need to be a little bit more vigilant. If you notice that somebody has lost a lot of weight, mention it. Don't come straight out with, oh, do you have an eating disorder? But say, I do notice you've lost a lot of weight. Is everything okay? It can be indicative of a different problem. For example, my mum lost lots of weight in her 50s. She was always a little bit overweight, then she lost loads of weight. And of course, we all started by going, oh, wow, you look fantastic. But it turns out she's got type 2 diabetes. She manages it now. But losing a lot of weight can be indicative not only of an eating disorder, but actually of another serious health concern as well. If somebody is avoiding eating in front of you, that is a form of disorder. Similarly, if somebody invites you over, cooks a lot of food, but then doesn't eat themselves, or just says, oh, I've eaten loads earlier, again, those are just warning signals. The other thing is, it's very difficult to know when someone has an eating disorder or whether they just have disrupted eating for a little while. It's perfectly normal if you've had a bout of food poisoning from a sausage that's been left out in the open a little bit too long. It is not unheard of to go off that food for a while. Similarly, if someone's under a lot of stress, again, it is not unheard of to crave sugary foods and just need that little bit of an uplift. But again, those things are not ongoing. So an eating disorder is very different to that, because an eating disorder stays with us for a much longer time. So warning signals are things like excessive weight loss, refusal to eat in front of you. Another one, which I'm loath to mention because it can be indicative, but not always, and this is just something in my experience, is the smell of mouthwash after every meal. And that can be something that people use to just disguise the fact that they are throwing up after the meal. It's not necessarily the best warning signal, because you know, if you're going to go to an important meeting, you may well bring your mouthwash with you, but it's one of the things to look out for. It's very important to seek help if you have an eating disorder, and one of the most successful therapies is cognitive behavioural therapy. The reason that one is so successful is if there is an underlying psychological problem, and in many cases there may well be, then the cognitive element of that helps us reframe our thinking, and it's the behavioural element that reframes our relationship with food. So cognitive behavioural tackles both sides. It tackles the practical side, but also tackles the mindset, which is so significant in eating disorders. The other place to go for help sometimes may well be a doctor, purely because if you've been making yourself sick, you can have damaged your throat, you can have made that very, very raw. Similarly, you can have damaged your enamel on your teeth as well, so a dentist, and other physical help may be needed too. If you are worried, I am loath to say websites, because there are some very supportive websites, but there's some very dangerous ones out there as well. So parents, be aware that there are websites called pro-ana or pro-anorexic websites, and they can form a very dangerous community to propagate the eating disorder. However, there are of course positive and support groups out there as well. If you are worried, please speak to someone, whether it's the school nurse, school counsellor, even just the teacher at school, because they can then mention it to someone else. A lot of the time with eating disorders, you notice the pattern over time, so it's worth just being a little bit vigilant and keeping track and seeing if there is a pattern, or whether the eating was just disrupted for a little while for reasons as I've said before. But the main thing is, if you do notice something, monitor it and do seek help.
Now I have with me medical nutritionist Babi Chana on the show, who will be telling us the importance of healthy eating and also the impact that eating disorders can have on a person's physical health as well as their mental health. Hello, Babi.
Hello, Chrissy.
Lovely to have you back on the show.
Thank you very much.
So do tell us about some of the history of eating disorders, first of all.
Well, it dates back centuries ago, but obviously it's much more prevalent now. You don't actually see it so much in third world countries, but in Western countries, I think the NHS and Department of Health are saying there's been an increase in 15% since the year 2000. And that could be, as you had on the news, that there's more pressure socially with magazines and what have you. But it tends to range in girls from about 16, 17, maybe starting younger, just dieting, but then that gets a bit out of control, out of hand, and it escalates from there. And it can go well into sort of adulthood. Some people get better, about half people get better, 30% get, you know, recover a little, and some people carry on with it being really, you know, detrimental to their whole life pattern forevermore. Wow. And it can actually be fatal. So you've heard of Karen Carpenter that died of the disease. So amongst psychiatric disorders, it does have the highest rate of mortality. So you were saying about mental problems. Yeah, it's genetic to some degree, but it's your social upbringing, your culture, your relationships with your parents, with peers. So multifactorial. There's lots and lots of reasons that people might, you know, get into eating disorders, and all of them have to be addressed. So it's not always the eating that's an issue, but from the nutritional perspective, you'd worry that somebody's not eating enough, and therefore they'd end up nutrient deficient, and therefore if they haven't got the building blocks to their, you know, making their own bodies, then clearly they're going to suffer as a result.
Yeah. And what can you just tell us about maybe some of the physical effects as well that eating disorders can have on a person's body?
Well, everyone's very individual, so the symptoms an individual will suffer in the short term or longer term will vary. So it's not one size fits all. But for example, being a mental disorder, fatty acids like omega-3s are very important fish oils in your mood, behaviour and learning ability. So it has been found that there's a very high deficiency of the omega-3s, particularly DHA and EPA, particularly for pregnant mums. So it could start within the womb itself before they're even born. And there is now convincing evidence, that the neurodevelopment of the child needs DHA, and there's convincing evidence for that. If the brain isn't fed, because we're all obsessed with feeding the bodies, which requires protein, but fat in itself has got a phobia, so people are avoiding fats.
What kind of fats apart from the omega-3? And
omega-3 is particularly important for the brain. So if a mum isn't eating enough fish or adequate fish, or even, you know, it's oily fish in particular, so it's not available in any other food, you see. So in the nuts and seeds world, flax seeds and chia seeds, they'll have some, but overall it's quite hard to obtain from the diet. So in the 1970s, a prevalent researcher, he said that mental health would cost more than heart disease and cancer put together, and I think we're arriving at that now. And one of the factors, obviously there's lots and lots of reasons, is a deficiency in omega-3s as well. So that's a very important part of not getting depressed, for example. But also you can't just blame it on that deficiency. You've got to look at, I mean, young girls will try to be perfect, or they'll be very academic, or they'll want to have the perfect body with peer pressures, whatever it might be, you know, a paternal reason, or, you know, all sorts of reasons why somebody might get into that. But not being, if you're having enough omega-3s is going to just exacerbate the problem. And then things like zinc may become deficient. That's very important for appetite and taste. So you
Where do we find zinc? What kind
zinc
of food?
is in seafood, in meats, again in nuts and seeds. But the problem today is that I call it fat but starving, in the sense that although anorexia and bulimia are quite rare, Department of Health figures will say it's like 1 in 250 girls or 1 in 2,000 males will have it. So in the year 2015 there were 750,000 people in the UK suffering from it, but figures vary because not everyone will own up to it or get help, so there's probably a lot more than that. But it's because they're not eating enough, and therefore they're not getting either calories or nourishment, so their weight will drop. But I'd like to highlight the flip side of it, where we're seeing increasing numbers of people, and children particularly, that are overweight or even obese and diabetic. They're eating what I call empty calories, so they're left fat but starving. So they're also nutrient deficient, although they're eating lots and lots of food.
Food, right?
Yeah, so it tends to be,
like,
say, you know, refined foods like white bread or white sugar, or just refined products that are nutrient deficient. So that's another problem with, you know, a different issue altogether.
I mean, when maybe you are approached by someone that has an eating disorder, I mean, as a nutritionist, what kind of things, how would you work through that, and what would you recommend for anyone that does come to you? Although I know it must vary quite a bit for
again,
person.
being multifactorial, I wouldn't say that nutrition was the only angle to help somebody. They'd need some kind of psychotherapy or cognitive behavioural therapy, and parents would need to be talked to as well. But then, because the individual probably be obsessed with calorie counting, it's the quality of food maybe a nutritionist would give them. So in, you know, highly nutritious foods like nuts and seeds, there'll be small quantities, but they'd be very nourishing. And for example, we would make sure that the specific nutrients like DHA, I mean, the individual might not like fish, so you might have to think of another way of getting that. But zinc would be a very important issue, because they can't taste food, and it, you know, is required for appetite as well. And then some individuals will be, say, taking laxatives, and then their electrolytes will go out of balance. So if there's not enough potassium, for example, in the body, that would have a long-term effect on your heart. And so there's lots of different issues, even with your hormones. For example, if your weight drops too low, then you may, you know, lose your periods because there's not enough estrogen. So it depends on the individual how many, you know, what's specific to them, because not all of them will be taking laxatives or purging. You know, some of them just may be abstaining from eating food, and by telling them to eat a lot more, you're not going to get that much cooperation. So it'd be quality foods and balancing their blood sugar levels maybe.
You mentioned potassium. Where can we find that? What kind of foods?
That's quite, you know, it's not something we tend to have to worry about. Bananas are well known to have a lot of potassium, but our kidneys will take care of electrolyte levels. But because they're abusing laxatives, they're having a lot of fluid loss or vomiting, so their fluid goes out of balance and out of kilter. So you have to see what that particular individual is doing and what you have to put right, so that won't be applying to all of them.
Okay, so if someone does have an eating disorder, would their first port of call be a doctor, and then a doctor will suggest, like, okay, you need to see a nutritionist, you need to CBT, for example, so it's like a whole range of things? Would that first be the doctor then?
Yeah, I think the doctor would be the one to make the diagnosis, and it's very difficult to make a diagnosis. You have to fit certain criteria, otherwise they'll just, you know, call it an eating disorder as opposed to anorexia or bulimia. So yeah, the doctor would make the diagnosis, and then you'd need different treatments, and psychotherapy would be a huge part of that, and probably involve family as well.
Right, which is very important, which you mentioned earlier in the news. So Babi, thank you so much for your input today. It's been great having you on. Thank you so much.
Thank you.
Right guys, so don't go away, because after the break I'll be joined by resident nutritionist Hannah Richards, and we're going to be making some healthy teas. Welcome back to our show, everybody, which has been all about eating disorders. But now I'm here with Hannah Richards, who's going to tell us all about the health benefits of tea and how that can actually affect our mental health. Hello, Hannah.
Hi, Chrissy. How are you?
I'm good. How are you?
Very well, thank you.
Lovely to have you in the studio.
Yeah, it's good to be back.
And by the way, guys, if you've just joined us, if you're a new viewer, Hannah actually does lots of lovely videos for us with yummy recipes, very healthy, and you can find those on our YouTube channel, Chrissy B Show, under healthy recipes. So tea, why is it so good for us?
Well, as you know, I'm all about gut health, and I always think that if you have a happy gut, then you have a happy head. And because we're talking about mental health, the majority of our happy hormone, which is serotonin, is made in the gut. And so and a lot of people look at other things, but you know, we all go through times when we're a little bit bluesy or depressed, and that leads to lots of things, and it definitely is multifactorial, of course. But if you start by cleaning out your gut, reducing inflammation, then you've got better chances of having a brighter and a happier outlook on life.
Okay.
So that's where I come from, and that's what I try and do with, you know, patients that I see, clean out the gut, and then you, as I said, you've got a clearer outlook. So
clear outlook, happy, yeah. Sounds good.
Yeah.
And by the way, these ingredients smell so nice. I can't wait to get started.
So first of all, we're going to start with some lemon. So lemons are beautiful for clearing out the liver and cleansing the liver and the gallbladder, and they're great for detoxification and things like that. So it's really nice to have you might have had when you've done a detox before, lemon and water in the morning.
Yes, yeah.
Really easy, cheap thing to do. So we're just going to squeeze some lemons into our cups of tea here. And there's one for you.
Thank you.
And you know, you can do half a lemon, or there's another one, a whole lemon, and just squeeze the juice in, pips and all. Okay. And then just add some hot water. Let me take that cup over. You could even have a jug in the fridge of water, and then have your lemon in it as well, and drink that first thing in the morning, just as a nice liver cleanser. So there we go.
Thank you.
So that's 1 cup of tea. Nice, easy thing to do.
Lovely.
And it's just very simple.
Tastes like lemsip. To be honest, I don't really like lemsip much. I've always had hatred, but this is it's different.
Well, you could put a bit of honey in it then.
Yes. I prefer that.
So that's really nice and easy to do, and you can do that first thing in the morning, last thing at night. And it's also nice to sort of create a bit of routine as well. Yeah. Certainly when people have got, you know, maybe a bit of a control issue around food or whatever it is, you know, turning something into being able to control your health at the same time. Yeah. So having the sort of ritual of making tea in the evening with some beautiful fresh ingredients is a nice sort of habit, and a healthy habit to get into. Nice. And really it's just about creating healthy habits.
Is 1 cup enough per day, would you say, or would you need more?
Yeah, no, I'd say 1. You know, I'd say if you could get the juice of half a lemon or a whole lemon in every day whilst you were doing a sort of a clear out, would be really ideal. Okay. And it's all about replacing one thing for another thing. So if you have a cup of tea in the evening with some beautifully clean ingredients, then what are you replacing? Maybe you're replacing that hot chocolate or couple of hobnobs, and that's good for you. So
yeah, you wouldn't really go, would it, to have a couple of hobnobs on it?
No, and that's the other, you know, that's a good thing as well. Like when you have one of these sorts of teas, it cuts your sugar cravings or your need for something sweet. You know, we always want something sweet after dinner.
Yes.
And sometimes that's really just a bit of a habit as well. Yeah. But if you got into this, then you would, you know, if I had a couple of hobnobs now, I doubt you'd want one.
Not at all.
Okay, so then your next cup of tea, we're just going to add some ginger, and this is fresh ginger root. So you could get, you know, you could take ginger in a capsule, and then really the best thing to do with ginger is just sort of grate it on your cheese grater, and then you get more of the infusion. Yeah. If you can't find ginger, and really you can get it in most supermarkets these days, you could use a ginger tea bag. All these ingredients will probably come in a tea bag form, but it's
not the same, is it?
It's not the same. I mean, it's
lovely. So even
great.
It's just lovely.
And this is great for digestion. So again, happy gut, feeding all those we want good bacteria in our gut, and if we've got good bacteria, then it's a nice happy environment. It's a bit like a rose bed, and you want to sort of think about your gut as a beautiful rose bed with not too many weeds. If there's too many weeds, we've not sort of been attending it or looking after it, and then we create a dysbiosis, which means that there's more bad bacteria than good bacteria, and then we're going to feed that, and we normally feed our gut with bad foods like white sugar. And as you know, when you're feeling a bit bluesy and down, you eat food that's got really high sugar amounts in it to sort of almost block things out.
That doesn't work.
Yeah. So it's all about looking after that rose garden in your gut. So we're going to add some ginger. We'll cut it a little bit down, cut it a little bit further. Excuse the fingers.
That's okay. Now, how long would you actually leave this to infuse for it to have enough benefit?
Yeah, I'd say a good sort of 2 or 3 minutes.
Okay.
And when you want to get the therapeutic benefits from a tea bag, for example, 1 tea bag full of ginger and lemon isn't really going to give you the medicinal effects of those ingredients. So if you have got a tea bag, then you want almost 2 or 3 of them. Infuse them for 2 or 3 minutes and then drink it. Otherwise, you're just getting the flavour.
Yeah.
You know, which is nice.
But what's the point?
But what's the point? Yeah, exactly.
Because when I have herbal tea, I'm thinking, yeah, it's doing me good.
Yeah.
And normally it's just the one tea bag, so now.
Yeah, it's like when you sort of have a strawberry tea bag, it's just flavoured water.
Yeah, cheers. This one's really nice.
I love ginger.
Yeah, me too. And it's not hot, like that kind of...
Yeah, it's not too much.
Hot, yeah.
If you grate it, you could, everyone's got different sort of spice points, I suppose, haven't they? But if you didn't like that too spicy, some people ginger isn't for them. So in which case, you could just add a little bit of honey.
Yes. Health benefits of honey.
Antibacterial, good for the gut. A cleaner sugar than white sugar. People always say to me, oh, can I have honey? I say, well, of course, because it's all about what else might it be. We're not trying to be...
Yeah. So sometimes you hear so many different things though, because sometimes, it's better to have natural sweeteners, they'll hear a lot about stevia and all the others, and then some say honey is not good for you, and I'm like, oh, it's so confusing sometimes.
I would just say it's all about doing the next best possible thing. So, if you're someone that takes white sugar, then the next best possible thing might be brown sugar. And if you're someone that takes brown sugar, the best possible thing might be honey.
Yeah.
So it's a lot of people always want to help their mum or their dad or someone in the family be better than what they are. But if you take someone too far away from where their natural habitat is, then you just set them up for failure. And these days, all we do when we set out on a new diet or a plan is really set ourselves up for failure, which ultimately, isn't what we want, the reasons why we started it in the first place. So it's always about just the next best thing. Right,
just to take it a teeny bit off subject, because now I'm curious, what's the best type of sugar then to have?
Oh, well, I'd say honey.
Okay, that's fine with me because I love it.
Honey is one of my favourite foods. I'm like Pooh Bear. I could just eat honey all day.
Okay.
No, and there are different qualities of honey, so you do want to try and find, the best possible honey you can. A raw honey, one that hasn't been heated, an organic honey, one with a honeycomb in. Just whatever you can find.
Lovely. This is really nice. I think I'm just about ready to go to sleep now.
Ooh, yeah, see? Immediately, and it's warming and it's cosy, and again, it's going to, help you keep a nice, healthy diet. It's going to stop you eating the biscuits at night or wanting something else. It's really good for your digestive system, which wants to just be settled in the evening. And I think, certainly in London as well, people eat so late into the evening, and then their tummies don't have enough time to digest their food, which means that we don't as efficiently as we could, and we go to bed on it and we don't have a good night's sleep. Then we wake up in the morning feeling a bit sort of grotty.
Yeah.
So it's all about good gut health.
Okay. Now we've got one more lovely looking ingredient over there, Hannah. Tell us what this is. Looks like worms.
It does, doesn't it? Look. It does look a bit funny, but it's called turmeric.
Turmeric, there you go.
And turmeric's quite popular. It's kind of the most fashionable food at the moment. Everyone's into sort of turmeric lattes and things like this. And again, you can get it in a supplement form, or you could get it in a powdered form. And it's really good for reducing inflammation.
Okay.
So the biggest organ in the body that gets, overused is the gut. It's like a water slide. And we sort of, need to look after it. So when we get bloated or when we have any issues with our gut, IBS is really prevalent these days, isn't it? It's really just saying the body is inflamed.
Right.
So these ingredients like turmeric are really good for reducing inflammation.
Okay.
Now, if you handle it too much, I'm going to give you a little piece to take.
How many do you think we should put?
Two or three.
Okay.
Let's go crazy.
Let's go 3.
It does stain your hands, so do be careful if you're... I love juicing turmeric.
Now, I found a recipe online it was turmeric tea again, but it was with coconut milk and the powdered turmeric, and what else did I put in it? was quite nice.
Honey?
Might have been honey, yeah, I think it was honey.
Yeah, it's really fashionable. I mean, you can go into a coffee shop these days and get a turmeric latte or something turmeric-y.
Yeah.
It is really everywhere. But it just gives it another layer, another sort of level of spice and bite to it.
That has really, really made a difference to the taste, and I've only just put it in.
Yeah. So imagine if you were to, if you juiced this, or if you grated it, or even chopped it down even more finely, you'd get more of that flavour. And if you let it infuse. I think the best thing to do really, if you want to get into healthy teas, is invest in a really nice teapot and sort of have a ritual in the evenings of making tea.
My mummy got me one, it's lovely, it's a clear one, it's got flowers on it and it's really pretty.
And,
it's got a nice handle and
drink it in a teacup.
Yeah.
You know, make a thing of it, you know, get British again.
So guys, this is honestly, this is so easy to do. The ingredients are very cheap and like you said, it's such a healthy thing to do as well, much better than sort of having hot chocolate or something like that.
It's medicinal.
Unless it's one of your healthy hot chocolates, which we have
of
seen on the channel as well.
Of course.
But Hannah, thank you so much.
Pleasure.
It's been lovely, and I'm going to carry on having some more tea. Right guys, so we have reached the end of today's programme, but if you have a story that you would like to tell us about, please do get in touch with us via the website chrissybshow.tv. You can also send us an email on info@chrissybshow.tv. And also, if you're an expert and you'd like to showcase your expertise on the show, you can also get in touch with us. Until next time, bye-bye for now.